Namaskar. Today I am going to talk about aplastic anemia. What is aplastic anemia? Many patients are thinking that aplastic anemia is a blood cancer. No, aplastic anemia differs from blood cancer. Then, what is the aplastic anemia? Aplastic anemia is a kind of very serious bone marrow disorders where your bone marrow stop producing new blood cells. Then what are the blood cells? Blood cells are RBC, that is the red blood corpuscles. Blood cells are WBC, that is the white blood corpuscles. WBC containing neutrophils, that is the polymer, lymphocytes, eosinophil, basophil, and monocytes. Then another blood cells is platelets. The patient who is suffering from aplastic anemia or pancytopenia, they are having the bone marrow disorders, that is their stem cells are not producing enough blood cells. Another problem is that the bone marrow which is destroying the cells are very faster. When a patient is having aplastic anemia or pancytopenia or ITP, MDS, Fanconi's anemia, they goes for blood transfusions or platelet transfusions. Once they get the transfusions, their cells increases for the shorter duration, that is the 5 to 7 days. Again the bone marrow destroys their cells, and again their cells count is decreasing. When your blood cells counts decreases in your CBC reports, you may face some problems. For example, if your platelet count decreases less than 10,000, whereas the normal platelet count is 1,50,000 to 4 lakhs in a normal human being. And if you are having aplastic anemia or bone marrow disorders or MDS or ITP, your platelet decreases from 1.5 lakhs to 50,000, 60,000, 40,000, 20,000, and if it decreases less than 10,000, bleeding starts. Bleeding starts from any orifices of your body, such as from nose, that is the epistaxis, from mouth, gums bleeding, teeth bleeding, from urine, from stool, which is known as hematuria. If blood comes from urine, the condition is known as hematuria. If blood comes out from the stool, the condition is known as melena. And another problem is with the females. The females are complaining that their menstrual period prolonged for even 4 to 6 months. The normal menstruation duration is 4 to 5 days, and those who are having aplastic anemia or less platelet counts, their platelet decreases less than 10,000 and their menstrual bleeding flow increases for 3 to 4 months. Even some patients complain about 6 months. When there is a bleeding, again the fall of hemoglobin. This is a very serious kind of condition which the patients are facing. When their red cells decreases, their white cell decreases, their platelet decreases, their hemoglobin decreases, they rushes to their nearest hospital. Many patients are, after taking treatment from their nearest hospitals, they not satisfied and they goes to higher centers like AIMS, PGI, CMC, Vellore, etc., and many other hospitals. What the hospitals they did blood transfusions, platelet transfusion, PRP transfusion, SDP transfusion, RDP transfusions. Transfusion is not a proper treatment of aplastic anemia, MDS, ITP, or pancytopenia. The proper treatment is homeopathy. By the help of homeopathy, we are increasing the cells in the body and stopping the destroying of their cells. Once the destroyment of your cells in your body, the cells increases automatically in your CBC count. Then what is the symptoms of aplastic anemia? Symptoms is breathlessness. The patient can't goes upstairs. He cannot work their routine work. He or she cannot do their routine work. Then easily fatigue, easily fatigue, easily bruisability, easily bleeding, then breathlessness, palpitation in your heart, and paler feeling, then pain in your joints or bone, and another problem is lack of immunity and continuous fever. Many patients comes to me and complaining their fevers doesn't goes down and the fever lasting for 2 to 3 months. So it's a very painful condition and patients are in hurry. They want a very fast treatment of aplastic anemia, but it's not always happening. They must take homeopathy treatment and give some time for the homeopathy treatment. Wait for the response of the homeopathy treatment. First of all, your bleeding should be stopped by the homeopathy treatment. Once bleeding stops, then you feel better. Once your cells increases, you feel better. Many patients goes for the ATG treatment. ATG, some kind of chemotherapy available in other treatments. Patients goes for the ATG treatment, and some patients goes for the bone marrow transplant. But the patients who are coming to our clinic at Advanced Homeo Health Center Indore, uh, maximum patients previously gone for the ATG treatment, and they are saying that ATG treatment is not so much effective and it is a very costly treatment. While homeopathy treatment is very effective, it may take some times, but if it will be effective, then you feel much better, your counts increases, and many patients are living their normal life and their platelets are increases from 5,000 to 1.5 lakhs, more than 1.5 lakhs, and hemoglobin increases from 2 to 3 gram percent to 10 to 12 gram percent, and their homeopathy treatment is stopped. They are not taking any kind of treatment, but their counts is normal and they are living their normal life. If you want any help from us, you can contact us. Our number is 9937008880. Number is 9937008880. We have prepared a diet chart. You can follow this diet chart, and this diet may help you in a better way. So for any kind of help, please contact us, Advanced Homeo Health Center and Homeopathic Medical Research Private Limited, Geeta Bhavan, Indore. And contact number is 9937008880. Myself, Dr. A.K. Dwivedi, Member, Scientific Advisory Board, CCRH, Ministry of Ayush, Government of India, and Director and CEO, Advanced Homeo Health Center and Homeopathic Medical Research Private Limited, Indore. Thank you. Namaskar.